This was my dad. He ignored 7 simple symptoms. He thought they were nothing. He thought he had more time. He didn't. His name was Frank. 70 years old. Tough. Proud. Independent. He'd lived a full life. He loved fishing, laughing with his grandkids, and tinkering in the garage. But he hated doctors. Always said, "I'm fine. Just tired. Just getting older." He had no idea that what he was ignoring was quietly killing him. He missed the signs. Signs that many men over 60 ignore. Signs that seem harmless. Until it's too late. Let's talk about the 7 symptoms he dismissed. Ones that you or someone you love might be experiencing right now. Number 7. Constant fatigue. Frank would fall asleep after breakfast. He couldn't finish a full day without a nap. Said it was just part of aging. But his fatigue was caused by low red blood cell counts, an early effect of cancer creeping into his bones. Number 6. Frequent urination, especially at night. He joked that he had an old man bladder. Got up 2, sometimes 3 times a night. It annoyed him, but he shrugged it off. In reality, his prostate had become enlarged and was pressing on his bladder. Something no man should ignore. Number 5. Back pain. He thought it was from gardening or lifting heavy boxes. He used a heating pad and kept going, but the pain was persistent, deep. Eventually, we found out the cancer had spread to his spine. Number 4. Changes in sexual function. Frank didn't like to talk about it. Most men don't. But declining sexual performance or weaker flow when urinating can be a critical early warning sign of prostate trouble. Reality. The prostate plays a huge role in sexual health. Pressure, pain, or dysfunction could be warning signs. Myth. It's just age catching up. Truth. Maybe. But changes in your private parts deserve a real medical check. Some doctors say this is the number 1 overlooked warning sign in men who avoid the doctor. Number 3. Mood swings. Frank became irritable, withdrawn. He lost interest in things he once loved. We thought maybe it was depression or loneliness. But changing testosterone levels due to prostate disease can affect mood in profound ways. Frank snapped at little things. He lost interest in his hobbies. We thought it was retirement blues or maybe depression. Reality. Hormonal changes caused by prostate disease or cancer can mess with your mood, motivation, and even memory. Quote from Dr. Alvarez. I tell my senior patients, ignoring symptom number 3 is like playing Russian roulette. You're gambling with your mind, your relationships, and your time. Number 2. Unexplained weight loss. He lost 10 pounds in 2 months without trying. He actually thought it was a good thing. Said he hadn't looked this slim in years. But rapid, unintentional weight loss in seniors should never be ignored. It's often a red flag. He said, "Guess I finally dropped my belly." Reality. Sudden, unplanned weight loss is a huge red flag, often one of the first signs of internal cancer. Myth. Losing weight is a good thing. Truth. Not if you're not trying. And the number 1 symptom? The feeling that something just isn't right. Frank would stare at himself in the mirror. He'd say, "I feel off, but I'm probably overthinking it." He didn't want to bother anyone. He didn't want to make a fuss. That instinct, that silent alarm, was the first and only warning he truly noticed, and he ignored it. And the number 1 symptom? The feeling that something just isn't right. Frank would stare at himself in the mirror. He'd say, "I feel off, but I'm probably overthinking it." He didn't want to bother anyone. He didn't want to make a fuss. That instinct, that silent alarm, was the first and only warning he truly noticed, and he ignored it. Let's pause here. How many of these signs have you seen in yourself or someone close to you? Maybe you've said the same things. "I'm just getting old. It's nothing. I'll get it checked someday." But someday is not a plan. Every 3 minutes, another man hears the words, "You have prostate cancer." 1 in 8 men will be diagnosed in their lifetime. But here's what many don't know. When caught early, when it's still localized, the 5-year survival rate is over 99%. That's right, 99%. That's the power of early detection. Some men face even higher risks. If you're African American, or if you have a father, brother, or son who had prostate cancer, your risk is significantly higher. You must be even more vigilant. Let's bust a few myths. Now, myth 1. I feel fine, so I must be fine. Truth. Prostate cancer is often symptomless in its early stages. Feeling fine is not a guarantee of health. Israel. Myth 2. All prostate cancer leads to aggressive treatment. Truth. Many low-risk cancers are managed through active surveillance, meaning regular monitoring instead of immediate treatment. Early diagnosis gives you more options, not fewer. Myth 3. I'm too old for it to matter. Truth. Age doesn't disqualify you from care. Many older men benefit from treatment that improves both quality and length of life. So what should you do today? First, book an appointment. A simple PSA blood test can provide early clues. It's quick, it's easy, and it could save your life. Second, keep a symptom journal. Write down anything unusual: frequent urination, back pain, fatigue, mood changes, weight loss. No detail is too small. Third, bring someone you trust to your appointment. They can help ask questions, take notes, and support you through the process. Fourth, learn your family history, ask questions, share information. Knowledge is power. And finally, visit trusted resources. The American Cancer Society at cancer.org, the Prostate Cancer Foundation at pcf.org, or use the Urology Care Foundation's tools to find a urologist near you at urologyhealth.org. Now let's come back to why this really matters, because this isn't just about you. It's about the people who love you, who still need you, who don't want to say goodbye before they have to. My dad didn't think it would happen to him. He thought he had more time. He didn't. I'm sharing this with you because I don't want you or someone you love to make the same mistake. So please share this message with your father, your grandfather, your husband, your brother. Tell them, I need you to see this because I love you and I want you here. This isn't just a video. It's a warning. It's a wake-up call. It's a second chance. And sometimes a second chance is all we need.